Today I'll be demonstrating the correct technique of obtaining a manual blood pressure. We'll first begin with the equipment needed. We'll need a sphygmomanometer, an inflatable rubber bladder, a blood pressure cuff of an appropriate size for our patient, and lastly, a stethoscope. Before beginning, ensure to perform hand hygiene in accordance with the 5 moments of hand hygiene. Allow the patient to assume either a seated or supine position, ensuring that they are in a quiet and comfortable environment. Also remember to explain the procedure. Elevate and support the patient's arm at height level, ensuring that the palm of their hand is facing upwards. Remember to remove any tight or restrictive clothing from their arm. Locate the brachial pulse just below the crease on the inner side of the elbow and arm, and use the middle and index finger to palpate. Then position the blood pressure cuff firmly around the patient's arm with the arrow approximately 2 to 3 centimeters above the brachial artery. Locate the radial pulse by using the middle and index finger to palpate the thumb side of the patient's wrist. Close the valve and estimate the patient's systolic blood pressure by inflating the cuff and taking note at which reading the radial pulse can no longer be palpated. Place stethoscope earpieces in ears and check to ensure that it's working appropriately. Place the diaphragm of the stethoscope over the brachial artery. Close the valve and inflate the cuff up to 30 millimeters of mercury above the estimated systolic blood pressure. Slowly open the valve, deflating the cuff at a rate of approximately 2 to 3 millimeters of mercury per second. Listen for the first sound, known as the Korsakoff sound, and take note of the reading, as this will be our systolic blood pressure, in this case 124 millimeters of mercury. Continue to gradually deflate the cuff, taking note of when the last sound disappears. This is our diastolic blood pressure, in this case 68 millimeters of mercury. This patient's blood pressure is therefore 124 over 68 millimeters of mercury. Completely deflate the cuff, remove it, and return the patient to a comfortable position, and clean all equipment appropriately.